of the research on addiction was focused on men. However, since the inclusion of women in these studies, it has been observed that there are significant differences in the way men and women use substances and react to substances. Despite using substances at a lower level than men, women typically progress from substance use to addiction more quickly than their male counterparts. Women also experience the health consequences of substance use, such as death, cancer, heart disease, and memory problems, sooner and more intensely than men. The most commonly used substances among women are alcohol, nicotine, and prescription medications. In all cases, except for prescription opioids like Vicodin and OxyContin, men are more likely to abuse the intoxicant than women. However, that gap has been steadily closing. Research shows that women metabolize alcohol less efficiently as compared to men. This is because women have decreased activity of an enzyme called as alcohol dehydrogenase, which breaks down alcohol in the liver and stomach and keeps it from entering the bloodstream. Women's bodies also contain less water and more fatty tissue than men of similar sizes, which means that they maintain higher concentrations of alcohol in their blood. As a result, women get intoxicated faster and have worse hangovers, even when drinking the same amount as men. When it comes to tobacco, women typically smoke fewer cigarettes, inhale less deeply, and smoke cigarettes with lower nicotine levels as compared to men. However, women are just as likely as men to become addicted to nicotine. These gender differences can be seen at a very early age. In one study, girls aged between 12 and 13 who started smoking at least once a month reported symptoms of dependence in a shorter amount of time compared to boys. It took them only 21 days, while boys took 183 days. Some research suggests that women are more sensitive to pain and may experience chronic pain more often than men. Women are also more likely to misuse prescription opioids like oxycodone and synthetic opioids like heroin to self-medicate for pain or anxiety. Furthermore, women develop a dependence on opioids faster than men due to a heightened dopamine response in the brain. Both genders are more or less equally likely to abuse stimulants, though women report first use at a younger age than men. Hormones may explain the biological differences between men and women with stimulant addictions. Women tend to experience more cravings and are more likely to relapse, probably due to changes during the menstrual cycle and hormone production. Human and animal studies suggest that estrogen plays a role in the dopamine reward effects of stimulants like cocaine and methamphetamine. Women may become addicted faster and take larger doses of stimulants than men because of this. Women tend to have different circumstances that men don't often experience that inform their decisions to use and abuse substances. Social stigma, extra life pressures, and shame affect both why and how women interact with drugs. Some of the unique reasons women turn to drug abuse include to reduce stress from the social pressures of being the perfect woman, which might include a loving mom, caretaker, house manager, career woman, etc. To lose weight in the face of demands from society and the beauty industry to look a certain way. To impress men or attempt to break stereotypes that women are unable to handle certain substances. To deal with sexual trauma, which women are much more likely to suffer. To self-medicate for a higher incidence of mental illnesses like anxiety and depression. Women are less likely to seek treatment for substance use disorders than men. This may be because there's a greater stigma against substance use for women. meaning that they are more likely to hide it if they have a problem. The only exception to this is with the abuse of anti-anxiety and sleep medications, for which women are more likely to seek treatment. Substance use disorders are treatable, and if women were to seek treatment, they would be able to lead far more rewarding and healthy lives.